Hello, doctor. Welcome to our discussion about angina. Could you please tell us more about this condition? Of course. Angina is a type of chest pain that results from reduced blood flow to the heart. A lack of blood flow means your heart muscle isn't getting enough oxygen. The pain is often triggered by physical activity or emotional stress. What is the particular reason for the pain? Mainly, blockage of coronary arteries makes it difficult for fresh blood to flow through them and into the heart. The lack of blood flow to the heart, called ischemia, is what causes the pain. But the pain does not last for a long time and relieved by rest. What about the types of angina? Could you tell us about them? Sure. First type is stable angina, also called angina pectoris. It is the most common type of angina. Stable angina is a predictable pattern of chest pain. Would you please explain more? This means, when the heart is not getting enough oxygen, stable angina occurs, so the patient starts to feel pain. And people with stable angina have symptoms most often when they are emotionally stressed or doing physical activity. So the narrowing of the coronary artery is main reason for stable angina? Exactly. And what is the cause of that narrowing? It is the atherosclerosis, which forms a plaque in the artery wall, which leads to reduction in the passage of the blood through the artery. What about the second type, doctor? Unstable angina, or sometimes referred to as acute coronary syndrome, causes unexpected chest pain and usually occurs while resting. The most common cause is reduced blood flow to the heart muscle. Because the coronary arteries are narrowed by fatty buildups, atherosclerosis, which can rupture, causing injury to the coronary blood vessel, resulting in blood clotting, which blocks the flow of blood to the heart muscle. So this type occurs at rest, and it is related to injury in the artery due to rupture in the atherosclerotic lesion and causes blood clotting. And this causes narrowing in the blood vessel, which in turn reduces the amount of oxygen delivered to the heart. And this causes ischemia and pain. Is that right, doctor? This is exactly what I was saying. Thanks for joining us.
Now come to the symptoms of the angina. The patient may experience some sort of dizziness and fatigue as well. The patient also may experience discomfort, especially on the hands. And the patient may feel heaviness or pressure on the chest. The patient may experience as well shortness of breath and difficulty in breathing. And the patient may complain of a squeezing and burning sensation on the heart. The patient may feel pain in the chest area besides some aches, and the patient may have some stomach upset, some sort of a stomach upset, or vomiting, or even sweating. We have something called electrocardiogram, ECG. This test records the electrical activity of the heart, which is used to diagnose the heart abnormalities such as arrhythmias or show ischemia. Stress test. This test is used to evaluate how well the heart performs with the activity or during stress. The patient will be asked to perform a physical exercise such as walking on the treadmill, and an ECG is recorded during the period of the exercise, and the ECG will reveal if there is any change in the heart if there is any problem with the heart muscle or the blood flow. There is also a blood test to identify certain enzymes such as troponin that leaks into the blood after the heart has suffered severe angina or heart attack. Blood test can also identify elevated cholesterol or LDL and triglycerides that can place the patient in high risk for coronary artery disease. We have also the chest X-ray. This images helps the doctor to rule out any other source of chest pain such as pneumonia. Imaging with X-rays involves exposing the chest to a small doses of radiation to produce pictures on the chest and heart. We have also CT scan, which is coronary computed tomography or CT angiography. This exam evaluates the coronary arteries and the blood vessels that supplies the heart to determine the extent of narrowing of the arteries due to plaque without the need of invasive catheter feeds through the arteries into the heart. We have also the magnetic resonance imaging, which is called MRI. The primary purpose of this exam is to determine whether there is a good blood flow to the heart muscle or not. If there is area of decreased blood flow, this could indicate a plaque with blood vessel narrowing. We have also catheter angiography. In this invasive imaging test, a thin or long plastic tube called a catheter is inserted into the artery in your hand or leg using a needle. The catheter is guided with a wire into the coronary arteries, is used to inject contrast material directly into the coronary arteries to determine whether there is any narrowing of the blood vessels or not. The images of the contrast material in the blood vessel are computed using X-ray and narrowing is shown clearly.